Welcome. It's my extreme pleasure to serve as the moderator for today's Ask an MS Expert webinar. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 90 countries around the world with the news that people affected by MS need to know. I'm also a non-scientist member of the International Progressive MS Alliance Scientific Steering Committee, where I work to ensure that the perspectives and priorities of families affected by progressive MS are reflected in all of the work undertaken by the Alliance. I'm a district activist leader for the National MS Society, and I also chair the Society's California Government Relations Advisory Committee. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm thrilled to be with you today. I see that people are continuing to join our webcast, so let's give them just another few seconds and then we'll get started. Thank you to all of you who are joining us today on GoToWebinar, Facebook Live, and YouTube Live. Due to the large number of participants joining us on GoToWebinar, everyone's been placed in listen-only mode. Today's Ask an MS Expert webinar is one of a series of virtual opportunities the Society is committed to offering, so I hope you plan on joining us each week. Our objective in all of our Ask an MS Expert programs is to connect with you, share important information that you can rely on, and provide a forum for you to connect with experts on the topics that are on your mind. So as I chat with our expert today, please feel free to post your comments and questions as they come to mind on Facebook and YouTube, or type them into the question box if you're joining us on GoToWebinar. I have a helper working behind the scenes with me today. Julie Fiel is ready and waiting to capture your questions while I'm busy talking. We'll try to answer as many of your questions as we can during the Q&A portion of today's program. And I know that many of you might have some very specific questions related to your own situation. Because of our limited time together, we're going to be focusing on the questions that pertain to everyone. And following the webinar, the Society's MS Navigator team will be standing by to address those specific questions that you might have. I'll be sure to let you know how you can reach an MS Navigator before the end of today's program. And if you're interested in reviewing today's conversation with our expert, this webinar is being recorded and it'll be available on the Society's website for your reference. About 60 to 65% of the people living with MS experience some degree of change in cognition. And more than half of the people living with MS experience mood changes at some point in the course of their disease. It's important for everyone to know that they're not alone in experiencing these very common symptoms, and there are steps you can take to effectively manage them. Today, we're talking with Dr. Meghan Beier. Dr. Beier is an assistant professor of physical medicine and rehabilitation at the Johns Hopkins University School of Medicine. As a rehabilitation psychologist, she specializes in cognitive rehabilitation and neuropsychological assessment and intervention. Dr. Beier works with patients with a variety of neurological and psychological conditions, including multiple sclerosis and traumatic brain injury. Dr. Beier is also an active researcher interested in cognitive rehabilitation, mental health, and the healthy aging of individuals with multiple sclerosis. Welcome, Dr. Beier. You've published a number of articles based upon research that you've done on cognition and mental health, and I'm hoping you'll get us started by sharing what it was that made you passionate about specializing in these specific areas.
Sure, I'm happy to be here. And I think a few things. I've always really been interested in the connection between brain and behavior. I remember in high school sitting on the beach reading this book called The Man Who Mistook His Wife for a Hat. But as I progressed through school, I started to recognize, especially in grad school, that there's a huge gap in not only research, but in care around these two topics. and especially in MS. Other populations such as brain injury and stroke, these tend to get a little bit more attention, and especially when I was going through grad school, there wasn't a lot going on at that time. I think that's changing, and but I wanted to kind of be part of the group of people that helped to change that. And because both of these factors have such a huge impact on people's everyday lives, I think they're really important and they need to be addressed.
How do cognitive issues present themselves in MS, and how can those cognitive issues impact an individual's quality of life?
So the primary area that most people experience, but maybe they don't feel this exactly, is that their brain works a little bit slower than they used to, and we call that slowed processing speed. But what that might look like in real life is that it might take longer to do things that used to be really easy for you. So it might take twice as long to write an email. Or if somebody is talking really fast, I've had patients describe this as sort of the Charlie Brown effect, where it almost sounds like somebody is going wah, 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 like they hear the sound, but they're not processing what the person is saying. So they might not capture everything that they're hearing. So that slowing down is part of MS. People tend to get easily distracted. So, if the TV is on and their partner is trying to talk to them, or the dog's barking and they're trying to talk on the phone, they can get easily distracted and feel very overwhelmed. Many people experience difficulties with finding words. They might have to talk around the word, or they just can't get their thought out the way that they used to. And many people have difficulty with learning new information. So many people feel like they have a memory problem, but what actually happens is that their brain is taking longer to learn information. And so they have to reread information, or they have to rewatch a TV show, or they have to ask their partner to repeat themselves in order for that information to get encoded. But I think one thing that I am really passionate about, and something that I really want to emphasize throughout our conversation today, is that there's a huge overlap between emotions and cognition. So, for example, I had somebody the other day who told me everywhere she goes, she drives with a GPS, and she would drive to the grocery store, and she knows how to get there. But if she doesn't have the GPS on, she gets distracted and she might go too far or not make her turn. The emotional side of that is that maybe there may be attention problems going on, but maybe she's also worrying about something that's coming up later. She's thinking about a conversation that she had. And so that worry is in and of itself takes up cognitive space and is a distractor. And then if she misses her turn, then she starts to talk down to herself. Oh, I can't do this. Why do I always do that? And so we really need to pay attention to both addressing the cognitive symptom itself, as well as the emotional symptoms around any cognitive lapses that happen.
Samantha wrote in saying that when she started experiencing cognitive changes, she was embarrassed by them, feeling she was losing her mind and that her intelligence was being compromised. After several years, she finally talked to her doctor about it, and now she wishes she would have done that sooner. Dr. Beier, how common is this situation, and what advice do you have for people who are noticing, or their loved ones are noticing, a change in their thinking?
Yeah, it's really common. There are some people who mention it right away, but I think some people sort of attribute those changes to normal aging, or they sort of write them off, or maybe they think that there's nothing that can be done. But I think it's really important to speak to your doctor sooner rather than later. We know from research that about a third of people that have MS already have some sort of cognitive change at the time of their diagnosis. So it's never too early to talk to your doctor. There's certainly things that can be done. I mean, it's not just MS that can impact cognition, and many times there may be factors that need or could be addressed that would improve somebody's thinking. So, for example, certain bladder medications have an impact on cognition. And so if you've recently been started on a bladder medication and noticed that your thinking has changed, that might be something to talk to your doctor about. Or things like sleep apnea are much more common in people with MS, even if you don't have those typical sleep apnea precursors or typical symptoms. And so that is a cause of cognitive change. So it's not only worth it to mention because of MS itself, but because there are a lot of different factors that can contribute to strong cognition or strong thinking that your doctor can have a direct impact on.
Samantha mentioned that she's also concerned about her intelligence. What aspects of someone's cognitive function are actually affected by MS?
Yeah. So like I mentioned before, things like speed, brain speed, attention, learning and memory, word finding, those are all very common. But the one thing I do want to emphasize, especially about Samantha's story, is that MS does not impact people's intelligence. So I'll give an example of this. There was a study that was done at Kessler a while ago, several years ago, that looked at MS patients' ability to learn. And so they took people with MS and people without MS, and they gave them this long list of words. They kept repeating it to them until they learned all of the words. So what they found was that people with MS could learn all of the words, and they remembered them after a delay, just like the people that did not have MS, but it took them longer to learn the words. So it took them more trials. So it's not that your intelligence has declined. It's not that you can't do it. It's that sometimes it's going to take a little bit longer or more effort. And that's incredibly frustrating for people. I don't want to underplay that. But certainly I want to emphasize that people's intelligence has not declined. It may be that you need some compensatory strategies or a little bit of a boost to try and improve some of those symptoms.
You've kind of mentioned this a little bit already, so let's talk about assessing and treating cognitive changes. How does someone know when it's time to discuss their symptoms with their healthcare provider? What does the assessment process entail? And while we're talking about it, what's the difference between screening and assessment?
Sure, yeah. So I think it's, like I said, I think it's never too early to talk to your doctor about it. If your symptoms are having any impact on your home life, your work life, or your interactions with other people, it's definitely worth speaking to your physician about. If your family members are noticing a change, or coworkers or friends are noticing a change and they've mentioned it to you, then I think it's worth talking to your doctor about. In terms of screening versus assessment. So screening can look different depending on what physician or provider you go to. It could be as short as a 90-second brain speed test. It could be, many neurologists will give a test called the MoCA, or the mini mental status exam, which involve kind of asking you 3 to 5 words, having you repeat them, and then asking you to tell them later, along with kind of showing you some pictures and naming animals. So there's kind of a brief sort of 10 to 15-minute assessment that some neurologists give. Some neurologists will give a screening that's computerized. So I'm hearing and seeing more and more about that. The idea with a screening instrument is that we're trying to cast the net wide. So there may be a chance of a false positive, but the idea is we want to pick up on anything that is happening or that might be changing, and then refer you for a full cognitive evaluation. The idea is that those assessments don't tell you why the symptom is happening. They only tell you that there might be something happening. So the full assessment is usually done with either a speech pathologist or a neuropsychologist, and that can take anywhere from 2 to 6 hours. Some neuropsychologists do a lot of testing. And it involves kind of a full background history of the medications that you're on, any mood changes you're experiencing, what medical conditions you have, because not just MS impacts your cognition. There are other kinds of medical conditions that can impact cognition. And then it might also involve some tests that look at personality and emotions as well as cognition. So really trying to paint a very clear picture of what's going on and try to parcel out what is driving the cognitive changes. So if you're having memory problems, is that because you're actually having a memory deficit, or is it because of that brain speed? That information is really important in terms of treatment, because if we treat you for memory, but it's really the brain speed problem, we may not actually see a difference in your functioning.
Well, I'm glad you just mentioned treatment, because that was going to be my very next question. Can these cognitive problems be treated? And are there things that people can do to improve their cognitive function?
Yes, absolutely. So I've kind of mentioned a few of these things already, but first, when I'm working with somebody, and I think this is true for most people that that work with cognition, the first thing I want to do is eliminate or address any contributors to cognitive difficulties that are outside of MS. So like I was mentioning before, what are the medications the person is on, and how might they be impacting cognition? Do they have any other conditions like sleep apnea that might be impacting cognition, or even just poor sleep, right? Because even difficulty sleeping can have an impact on your cognition. So eliminating or addressing any other issues that are outside of MS. So that's kind of a first step. The next, I think, is optimizing your own health. So we know that a healthy body equals a healthy brain. So if you're exercising regularly, if you're eating well, if you're socially engaged with people, you're going to have a healthier brain, and you're not going to have as much cognitive decline. So we want to kind of optimize those areas. We also want to optimize emotional health. So as I mentioned before, there's a huge overlap between cognition and emotions. And we're even seeing that with brain changes. And so there was actually a few weeks ago at one of the conferences, the Consortium of MS Centers, I believe it was Dr. Feinstein who reported on a study where he found that people with MS who had depression were 2 to 3 times more likely to get distracted during cognitive tests and therefore have an impaired score if they had depression. If they did not have depression, there were still people that were having difficulty with cognition, but it was much less likely. So we really want to optimize your emotional health. And then finally, we really want to focus on those specific cognitive symptoms. So the way we do that is you can work one-on-one with a therapist, which would be like a cognitive rehabilitation therapist. I describe that as kind of like a physical therapist for your brain, right? You exercise the areas that feel a little bit weaker so that they can be strengthened. And that might be with a speech pathologist or an occupational therapist. So there's some really good data. Actually, the most data behind optimizing or improving cognition right now is with cognitive rehabilitation. So working with those therapists. And there are also some at-home programs like Brain HQ, which have been studied at places like I think NYU and Kessler, and they've found that that has been helpful for people with MS to improve their overall cognition. So it's kind of multi-tiered. You can do a lot of these things from home, right? You're optimizing your health, optimizing your emotional health, and then even some of the cognitive exercises can be done at home.
We've heard from Nancy, who says she's excited that we're covering this topic. Nancy has progressive MS, and she's been dealing with cognitive issues for the last 3 years. She wants to know if there's any research being done specifically on cognition, or is there any new information that's emerging about cognition?
Sure, yeah. So there's a lot going on. Before this interview, I went on to clinicaltrials.gov and I looked at how many studies are currently happening or have recently been completed. And there's 323 studies that are either currently running or recently completed. And they look at a whole bunch of different areas for intervention. So some of them are behavioral interventions, like I mentioned, with cognitive rehabilitation, either working with a therapist or computers. Mindfulness has kind of risen to the surface. So the idea of mindfulness is being in the present moment and being able to move your thoughts from wherever they are to something that's happening in the present. And that exercise of being able to exercise your attention, while it was originally kind of thought to be more of something for relaxation or for your emotional health, there's more and more studies that are popping up showing that mindfulness is really good for your executive functioning and attention, because you're exercising that every time you move your attention from wherever it is to where you want it to be. So that's something that's been popping up and is being studied. Exercise, everything from yoga to Pilates to treadmill exercises to aquatics to aerobic or strength training, that has been looked at or is being looked at. Dietary supplements and transcranial electric stimulation, the effect of different DMTs, which DMTs are disease modifying medications, have the biggest impact on cognition. Use of CPAP, like I mentioned, for sleep apnea, as well as different medications. So even where I am at Johns Hopkins, we're looking at intranasal insulin as a potential improver for cognition, as well as other things like Adderall. So there's lots of studies going on a lot of different areas, and I'm hopeful that we'll have more and more answers for people as we move forward.
Well, thank you for sharing some really helpful insights on managing cognitive changes, Dr. Beier. Before we talk about managing mood changes in MS, I just want to take a moment to welcome those of you who have continued to join us on GoToWebinar, Facebook Live, and YouTube Live. Please let us know what's on your mind. Post your comments and questions on Facebook and YouTube, or type them into the questions box if you joined us on GoToWebinar. Our Ask an MS Expert live event takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. We've been talking with Dr. Meghan Beier about the impact of cognitive changes in MS. Now I'd like to switch gears a little bit and talk about mood changes. We know that these two symptoms of MS don't exist in isolation. Mood affects cognition, and cognition affects mood. Before we get into our conversation, I just want to take this opportunity to mention that July is B.B. Moore Campbell National Minority Mental Health Awareness Month. So, Dr. Beier, what's the significance of having a month dedicated to minority mental health awareness?
Yeah, absolutely. I mean, I think it's pretty obvious that there are huge and significant racial disparities when it comes to both physical and mental health. We know that this is true in MS and across the board, where previously we thought that MS was a disease of female Caucasians. There's more and more data coming out that that's not necessarily true, and that for Black or African American individuals, there's some studies showing 47% greater risk of MS compared to whites. And right now, in terms of the MS literature, less than 1% of the MS literature focuses on racial minorities. So a huge, huge gap. Beyond that, when we think about mental health, people of color, Black and African American individuals tend to get diagnosed with more severe conditions than whites with the same symptoms, and they receive less treatment. So about 50 to 60% of Black individuals do not receive any treatment for mental health conditions. So we really need to do a better job of being aware as providers, being aware of what our biases are and our referral patterns, and generally as a health systems to be more cognizant of taking care of all individuals. And I think we need to do better in terms of research when it comes to MS as well.
Well, we know that depression is one of the most common experiences among people who are living with MS. In fact, about half of all people with MS will experience a major depressive episode at some point in their lives. And that rate is higher than in the general population. and it's higher than the population of people with other chronic illnesses. So let's talk about depression and MS. Dr. Beier, why do so many people with MS experience depression?
Yeah, so there's more and more data showing that there's a clear link between having MS itself and your risk for depression, and not just depression, anxiety as well. But there's kind of two reasons. One is that there's some structural changes in the brain that happen for people living with MS that's clearly linked to depression. And then there's also the factors of having to manage and cope with living with a condition that may impact your everyday functioning. But I also like people to think about what the symptoms of depression actually are. So some of those symptoms include low mood, not feeling as interested in things that you used to enjoy or that you can still enjoy, cognitive changes, sleep changes, fatigue, moving more slowly or feeling fidgety, appetite changes, feeling low feelings of self-worth, and thoughts of suicide. Well, if you look at that list, half of them are things that people with MS experience every day, right? So fatigue and cognitive changes and moving more slowly. So you really only need a couple of extra symptoms to meet criteria for depression. So I think it's a number of factors. We know that there are some structural brain changes. We know that living with MS can sometimes be more difficult for people, but then there's also these symptoms of MS that kind of already make you a little bit more susceptible to being diagnosed or having that confluence of symptoms that would make up of depression.
Now, I always remind people that MS affects families, not just individuals.
Mhm.
And I'm wondering, how does depression or other mood issues, how do they affect the family or people who are close to the person who's experiencing these issues?
It's a really good question. And it's definitely something that I 100% agree with. I tend to work a lot with families and not just the individual with MS. Number one, we should be aware that family members are also at higher risk for symptoms like depression and anxiety. So we shouldn't ignore them or not ask them how they are doing, that they are also at higher risk for depression and anxiety. But I think it's also sometimes difficult for families to know how to help, or even that the person is having symptoms of depression or anxiety, because sometimes that can look like irritability or can look like frustration or anger. And so then it comes out not as depression, but as sort of taking emotions out on the family, which can be really difficult. So I think a lot of what I recommend is communication, really trying to figure out what's behind anger and irritability if it comes out that way. One thing that I tell almost everybody is, if somebody's angry and they're irritable, what's the soft emotion behind that? Because there's usually something behind that, like fear or worry, or feeling alone.
I think that sometimes when we catch ourselves experiencing some kind of a change in mood, we try to marginalize it. We try to minimize it amongst our own set of definitions. So I'm wondering if you can, and you started to touch on this already, but you can explain maybe some of the early signs or symptoms that might indicate a change in someone's mood, and then tell us, is there some sort of a self-test that someone can take to screen for mood problems like depression?
Yeah, absolutely. So first, I want to emphasize that it's completely normal to have emotions that are not happy, right? So it's completely normal to sometimes feel that you are frustrated or irritable or have grief over things that have been lost. And so first, I want to figure out whether, or the individual wants to figure out whether or not these are just the normal experience of anybody who would be living through this situation versus something that's more serious. And one way that I do that is by identifying the length of time that you're experiencing these symptoms, whether you can pull yourself out of them, and how they're impacting the world around you. So length of time, if it lasts for a few hours, even sometimes a few days, and then you're able to pull yourself out of it, that might be normal. If If it's lasting for 2 weeks or more and you feel like you can't control the emotions, then that may be an indicator that there's something going on. Um, it's I tell people that if the symptoms are impacting your family relationships, they're having a negative impact on your family relationships or your social relationships, if they're having an impact on your work, or volunteer work or the things that you usually enjoy doing, those are also kind of red flags to me that this is more than just your typical emotional reaction to something that's difficult. If there are there are tests that you can take online. There's something called the PHQ-9 that you can Google that, PHQ-9, and you can take those tests online. They're free. It's 9 questions. It's just the symptoms that I listed off earlier of depression. It asks you how often you experience those symptoms, whether you experience them and how often, and then it kind of gives you an indication of whether or not you might need to seek help.
That's good to know. Janice writes that she was diagnosed with MS 8 months ago, and she's been struggling with anxiety ever since. Janice says that she's struggling with the uncertainty of how the disease will impact her future, and she wants to know if you have any advice on how she can best cope with that.
Yeah, absolutely. There was some research that was done, I believe it's at University of Pennsylvania, that looked at this not just in MS, but outside of MS. And there's a spectrum of tolerance of uncertainty and intolerance of uncertainty and all the places in between those two things. And this largely shows up for a lot of people that have medical conditions that are not sure what's going to happen. But so one thing I would say is that worry is sort of our brain's way of trying to warn us that something may be happening to us either now or in the future. And many times that worry is unhelpful if we can't do anything about it now, or there's not a way to act now. So sometimes some of the things that I tell people to do are, 1, schedule worry time. So give yourself some time every single day to let yourself worry and be upset and think about all the things that may or may not happen, but put a concrete barrier around that in terms of timing. So you might only do that for 10 or 15 minutes. And then if that thought pops up into your head any other time of day, you say, okay, I'm going to think about that during my worry time. You might want to journal during that time and just kind of let it all out. And another way to do worry time is if the thought pops into your head and you're worried about it, let yourself worry about it for a minute or two and then stop it. You might even have a timer on your phone that when that timer goes off, you switch your attention or you distract yourself with music, but you let it out. You know, we don't want to avoid it and we don't want to suppress it, but we also don't want to live there either. Another thing that you can do, especially with that idea that our brain is trying to warn us and we want to kind of think about a way that we can do something, is write down all the worries that you have and then circle the ones that you can do something about right now. So is there something that you can do right now? If you've already contacted your doctor, you're already taking the medications that you need, you're already doing everything that you can do to optimize your health, then you try to kind of mentally set it to the side. And if those thoughts pop up again, you might look at your list and just say to yourself, okay, I've done everything I can do right now. The other thing that I sort of mentioned earlier was mindfulness. So if we, when we are thinking about kind of mentally setting stuff aside, that takes an effort to be able to shift your attention away from the thoughts that are worrying you and onto something else. And so that might take practice. Mindfulness gives you that practice.
I think we may have lost your audio for a moment, Dr. Beier. I apologize. A study found that the risk of suicide is 7.5 times higher among people with MS compared to the general population. Wondering, what are the signs of suicide and Why is it so important to talk about suicide?
So for MS specifically, the risk factors in research have been things like severe depression. Males tend to be at a bit higher risk than females. It doesn't mean that only males are at risk, but they tend to be a little bit at higher risk. Social isolation, so not having relationships with other people, and alcohol use has also sometimes, alcohol or substance use is sometimes associated with higher risk. It's really important to talk about because talking about suicide makes it less likely. So there used to be some data, or there's this sort of general myth that if you talk about it, it might make somebody more at risk, or it just feels really uncomfortable. But when we bring it to the surface and we talk about it and examine it and look at all the factors, it actually makes it less likely, and it makes the person feel heard and understood. So it is really important to talk about and just kind of get a general understanding of what that person is thinking, and what they're what might be going through their mind at that time.
What about the person who says, just don't care if I wake up tomorrow? Now, is that person suicidal?
It's possible, but not necessarily. So about a fourth of people with MS will have some thoughts of suicide at some point in their lives. And there is some research that shows that the idea of thinking about suicide gives some people this sense of control that they might be lacking. It's maybe not the healthiest way of feeling in control, but it does sometimes make people feel more comfortable. And so it's if somebody says, I don't want to wake up tomorrow, I would start asking more questions. I'd certainly be concerned that that person was depressed and maybe needs some extra support, but it doesn't necessarily mean they're at imminent risk for suicide.
If someone is having thoughts of harming themselves, what should they do? Are there questions they can ask themselves or their loved ones? Are there specific resources available? What are the first steps people can take to get help?
Yeah, absolutely. So the questions that I ask if I'm concerned if somebody is suicidal, and certainly something that the person can ask themselves, is, do they have a plan, or do I have a plan? Meaning, I have a plan for committing suicide. I'm going to use some sort of means. You know what they are. That you have intention to carry out that plan. You know when and where you're going to do it. If the person has future-oriented thinking, meaning, are they talking about the future? Are they talking about things they're looking forward to? Are they thinking or hoping to do things in the future? Are there coping tools that they have and that they can use if they need to? And what does their social support network look like? Are there people that they can call on? And other factors that are really important are triggers. So what major life things are either happening or might happen in the future? So for example, the death of a pet or the death of a loved one. Are any of those kinds of things imminent, and could that be a trigger for somebody, as well as what the environment around that person is? So environment is, so with suicide, environment and slowing the person down are the two things that I think about the most. So certainly, if you have any of those risk factors, that you're have intent, you have a plan, you don't really have a lot of coping, and you don't have a strong social support network, I would call the National Suicide Hotline, or I would go to a nearest emergency room, or maybe even seek out an intensive outpatient program to help improve your symptoms quickly or more quickly. But in order to kind of make an individual more safe in their environment for themselves or a family member, something like getting rid of the means that they thought of. So if it's a gun, getting rid of the gun. If it's something that can't be gotten rid of, locking it up, because that slows somebody down. A lot of times suicide happens somewhat quickly or impulsively. And so if you have to slow the person down, meaning they have to unlock something and then they have to do a number of different things to get to those means, it might give them time to think through what they're doing. and certainly building up coping and improving social support networks. So a lot of times, if somebody is sort of thinking about, or this is really something that's been on their mind, I will have them sit down and take a piece of paper and write down what their triggers are. So what might happen that might trigger them to feeling worse, and who they can call immediately with the numbers written out so they don't have to think about it, and what coping techniques they can use in those moments, and also National Suicide Hotline. So just so that there's a piece of paper front and center, they don't have to think about anything for, here's where I can go for help if I need to in a moment.
What are some of the common treatment options for people who have suicidal thoughts?
So really, therapy and medication combined. Antidepressants, things like that, as well as psychotherapy, like talk therapy, combined have the best outcomes. For people who I work with that have more severe depression, I usually might recommend something like an intensive outpatient program, which is, a couple days a week, 2 or 3 days a week for half a day. So you're getting therapy and you're talking to people a couple times a week, and you're getting medication management regularly. So, and certainly there are inpatient programs as well, but there's lots of different options for people who might be thinking about suicide, or even who just have intense emotional concerns.
The National Alliance on Mental Illness tells us that the average delay between symptom onset and treatment is 11 years. Can you talk about the difference getting help can make, and why people shouldn't wait when it comes to seeking treatment?
Yeah, absolutely. So I still think that there's a lot of stigma around seeking help for mood conditions. And I tell a lot of people that working with a therapist at this point is not laying on the couch and telling them all your deepest, darkest thoughts. Working with a therapist is really problem solving with them and having them help you examine your own thoughts, your behaviors, and how your body feels, and how all those things might work together to either make your mood worse or make your mood better. And so it's really kind of an interactive experience. I think the one reason you should not wait is that it's possible to feel better, it's possible to worry less, and it's possible to feel more in control of your emotions. And so, why suffer longer than you have to? There are real treatments out there that can be helpful. And you're also in control of the process. If you don't connect with somebody, I tell all of my patients this, I tell people that I'm referring elsewhere, if you don't connect with a therapist or a program, seek out a different one. The number one thing that leads to positive outcomes in psychotherapy is your connection with the provider, your connection with the therapist. So if you don't feel connected to that person within 1 to 3 sessions, then move on and find somebody else, because there is a program or a person out there that can be helpful to you.
Well, thank you, Dr. Beier, for sharing your expertise on these important topics that people sometimes have difficulty addressing. Now I'd like to focus our time on addressing more of the questions from our audience. We've heard from Hannah, who says, some days I'll feel so short-tempered, moody, and have zero patience about anything and everything and everyone. And that's not me. Why is this happening?
Yeah, it's a good question. I mean, I might think about everything that's going on, right? And certainly right now in the time of COVID and all of that, we have a lot of just increased general stress across the board. And so when you think about, what you have going on in your home life, what you have going on in the world, what you have going on maybe at work, all of those things combined can lead somebody to just feeling overwhelmed and generally more stressed. And so their fuse is shorter. The other thing too is like paying attention to what you might be feeding yourself mentally. So I've been working with a lot of people who didn't realize how much watching the news all day, every day was impacting their overall mood. And so just by limiting the amount of time you're spending on things that might bring you down or make you feel more irritable or stressed or worried can improve your mood. So I'm not saying don't watch those things. I'm saying, limit them to maybe even in the morning, because I'm hearing a lot of people having difficulty sleeping. And if you're having difficulty sleeping, you're also going to be more irritable. So limiting your TV watching or things that might be worry inducing to the morning, and then just paying attention to what else is going on in your environment.
We have a couple of questions from Lori. She writes, I understand and I personally see the helpful impact that exercise has on MS. Does it help cognitive function as well? And Lori also wants to know whether there's any specific diet or specific foods that make cognitive function better or worse.
Sure, yeah. So for sure, exercise and healthy diet generally are helpful can be helpful or harmful to your cognition. There is some evidence coming out that exercise specifically can help with things like executive functioning. So in a secondary analysis of a study that I was involved with, we found that people who improved their overall fitness over the course of 12 weeks, and they got to choose whatever exercise they wanted, was also associated with improvements in cognition. And there's also some data from other groups that are looking at a combination of doing cognitive exercises while walking or cognitive exercises while doing some form of exercise. And that seems to also boost people's cognition. In terms of diet, there's not been a diet that shows that in MS you have an improvement in cognition, but we do know that things like that generally healthy eating can reduce your risk factors for things like white matter changes in the brain due to hypertension or high blood pressure. There's some studies in the aging literature outside of MS that something called the MIND diet reduced a person's chances for converting to Alzheimer's disease. And things that were involved in that is just generally sort of like the Mediterranean diet. Reduced red meat, more green leafy vegetables, eating berries, things like that. It's really about kind of overall health, and there's not necessarily one specific food that we know of right now that has an impact on cognition.
Someone has asked a question and they've asked that we not share their name, but they say, guilt is a never-ending emotion attached to my MS. And they want to know how common that is.
Incredibly common. I think there's a lot of role changes that happen with MS, and people are concerned about how that impacts the people around them. And even kind of how it might impact things like socializing with friends and even your work. And so, yes, it's incredibly common. And there are certainly things that can be done about that. And a lot of that is kind of working with a therapist to examine where those thoughts are coming from and any modification to your thoughts that might be helpful for managing that guilt.
We have another good question from someone who would rather remain anonymous, but they want to know, how can I help my husband better understand my mood changes?
It's a good question. I think there's a number of things. One is just being very open. It depends on the relationship, right? So some relationships are different than others. It may be being open and communicating regularly about what's going on for you and why that might be happening. Maybe it's sharing information that you get from your neurologist or taking your partner to your neurologist appointments to talk about these kinds of symptoms. There's certainly webinars that happen with the MS Society, but there's also an organization called Can Do MS that they do a big focus on support partners and educating both people with MS and their families as well. So kind of getting your partner involved in organizations like that may be helpful. There's also online support groups for support partners, so that they might be able to kind of hear from other people, other partners, about what they experience, and whether their family members living with MS have those same symptoms. So there's a lot of different options, and it kind of depends on the relationship and what the partner is willing and able to do.
Well, I'm going to see if my behind the scenes partner, Julie, might be able to pop up with a couple of more questions. I think we have time for a couple more questions. Julie, have any popped up while I've been busy chatting away?
There are so many questions. I know we won't get to them, so I'll try to be quick. I'll start with a question about cognition that I know is really common. Alicia's watching us on Facebook, and she says that she's very good at math, but recently she hasn't been able to do math problems. Her brain feels lazy. I can do the math problem, but know someone else is now going to get the answer before me. Sounds like she's competitive as well. Is that normal? Like, her brain is lazy?
So normal is a loaded term. So I'm not sure. I don't want to answer whether it's normal or not. It's common. It's common for people with MS, and that kind of goes back to that idea that I was talking about, brain speed, processing speed, or how fast your brain processes information is the #1 symptom of people living with multiple sclerosis. And so, like she mentioned, it doesn't mean that you can't do it, but it might mean that it takes a little bit longer than it used to. I will also mention that processing speed slows down for everyone, regardless of whether you have MS or not, starting in our early 20s or late 20s, I mean. So the entire population processing speed declines over time as we get older. So it may be that people will experience the same thing as Alicia was it, but it may be that they experience it, a few years after she does. That MS kind of brought that on a little earlier.
Well, it's interesting that you mentioned age, because we have several people, Joseph and Linda specifically, are asking about cognition changes that are happening because of MS and cognition changes that are happening because of aging. And how do you know what's what? And then the follow-up question that Joseph had is, and when does he know when he needs to get help for his cognitive issues?
Sure. So I think the main way that you can figure that out is with testing, because one of the things that we do when we do the cognitive testing is that we control those scores based on the person's age and how much education they've gotten. So we look at your score in comparison to, if you're 50, other people who are 50. And so because we know that cognition changes across the lifespan, we want to compare you to peers that are the same age and see, are you performing about the same as those peers, or are you performing differently? I don't think it's ever too early to start talking to your doctors about it if you have a concern, because there is always something that can be done. And actually, even if there's nothing found, there's also things that you can do to kind of mitigate or reduce the likelihood that you will continue to have a decline over time. So never too early.
I think I have time for one more question, and I'll try to see if I can get you to answer it as succinctly as possible. But I want to switch back to mood, because our last two questions were on cognition. Lisa is asking if we could talk about the difference between depression and anxiety.
Sure. So the primary, there's a huge overlap between the two of them, and it can show up. You can have the same thoughts, and it can show up as depression or anxiety depending on the day or what's happening around you. So depression, the primary things that we see are that your mood is low, you feel sad or down, and that you're less interested in things you usually enjoy. And I don't mean that you can't do anymore because MS has changed your physical functioning, but things that you usually enjoy. So if you enjoy talking with your family and now you're not interested in that, that's a change. If you're interested in watching TV shows and you're not interested in doing those anymore, then that is a change in your interest levels. With anxiety, it tends to be a kind of an activation, feeling worried and like you can't control your worry, or feeling more agitated. And so when I say it can show up as anxiety or depression, depending on the day, you might have the thought of, I'm worried, or what if this is an exacerbation, or what if my functioning changes over time? Sometimes that might show up as anxiety, where you think about how that could impact or change your life, and what can I do about this? And it can show up sort of this anxious thought process. It could also show up as hopelessness. Well, there's nothing that I can do about this, and so why bother? And so that same thought can have a different impact depending on how you're viewing it and what might be going on around you. So again, huge overlap, but it's either kind of more slowed down or kind of more agitated and can't control worry.
Thank you.
And thank you, Julie. Thanks to all of you who submitted your questions. And thank you again, Dr. Beier, for joining us today.
Thank you.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you. And these are resources that you can count on to be current, credible, and available when you need them. I want to also remind you that if we were unable to get to your questions today, please know the National MS Society's MS Navigator team is available to answer your specific questions and connect you to the very best resources. I'll share all the ways that you can connect with an MS Navigator in just a moment. I'd also like to acknowledge that we're in the midst of an emotionally difficult time for so many of us. And I want to make sure that you're aware of some resources that are available if you find yourself in emotional crisis. The National Alliance on Mental Illness is a reliable resource on mental health. They work to educate, advocate, listen, and lead to improve the lives of people with mental illness and their loved ones. And you can find the National Alliance on Mental Illness at nami.org. The National Suicide Prevention Lifeline is also available 24/7. They offer free and confidential support for people in distress, as well as suicide prevention and crisis resources for you or a loved one. And you can reach them by calling 1-800-273-TALK. That's 800-273-8255. And I'll remind you that every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you can take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Pandora, or wherever you find your favorite podcasts. You know, we're all witnessing that even during a pandemic, MS doesn't stop, and neither does the National MS Society. This webinar is just one example of how the MS Society has created virtual programming on the fly so that no one has to face MS alone. They've also created virtual support groups, provided resources and information about COVID-19 so that people affected by MS can get answers to their questions, and healthcare providers can deliver the very best care to their patients. The Society continues to amplify the voices of the MS movement to influence critical public policy decisions, and they never stop advancing the research that will find a cure. The National MS Society COVID-19 Response Fund has been established to ensure that the Society can meet the urgent and expanding needs of the MS community during these unprecedented times. And I'm asking, as you're able, to please support the MS Society's work by making a donation to the COVID-19 Response Fund. To donate, just text the word GIVE to 68686, and you'll get a link right to the MS Society's COVID-19 Response Fund webpage. I hope you'll contribute today because it's never been more important. I promised that we'd share all the ways for you to connect with an MS Navigator. You can find them on the MS Society's website at nationalmssociety.org. You can contact an MS Navigator by phone at 1-800-344-4867, or you can email an MS Navigator at contactusnmss@nmss.org. You can also connect with the National MS Society on your favorite social media channels, including Facebook, Instagram, Twitter, YouTube, and LinkedIn. And when you do, please make sure to like those posts and subscribe to those social channels. And you want to make sure that you get on the Society's mailing list by signing up at their website. That way, you'll receive regular updates on upcoming programs and the latest information on MS treatments, research, and how to live the very best life with MS. I'd like to thank Dr. Meghan Beier for joining us today, and I'd like to thank everyone who's joined us today for your great questions. Please remember that a recording of this webinar is going to be available for your review on the Society's website at nationalmssociety.org/MSExpert. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you happen to be watching on Facebook Live, you'll see a link to that survey pinned to the comments section. And on YouTube Live, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes 1 minute, so please take that minute and fill it out. On behalf of Dr. Meghan Beier and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.